I'm Nancy, and I'm a third-year PhD student based between two labs, Dr. Stephen Robinson and Dr. Lindsay Hall. My first supervisor, Stephen Robinson, specialises in breast cancer and more specifically devascularization with regards to breast cancer and how it starts. And Lindsay Hall is my secondary supervisor, and she specialises in the gut microbiota in early life, but she also has a ton of expertise in the gut microbiota in patients and adults. And essentially my PhD project and my research merges these two research topics. So my PhD project focused on the gut microbiota profile of breast cancer patients, and our main aim is to see how if there is a profile, if there's a pattern, and if we can use that to improve patient outcomes for breast cancer patients in the future. I fell in love with immunology in my high school years, and shout out to my biology professor, Christine Greenlaw. She actually basically taught us the macrophage and introduced us to this wonderful cell. And I was absolutely fascinated with how this one cell could actually do so many different things. And then that was, I guess, the stepping stone to the rest of the immune system, all the different cells. And essentially they just protect us from all these different foreign objects and make sure that we don't succumb to very easy infections, I guess. So yeah, that just kickstarted everything, and here I am today. In my opinion, breast cancer research is really important because we know it affects so many women worldwide. There is a very small minority of cases due to genetic factors, maybe roughly 10% of all the reported cases. So the rest of the 90% is actually due to environmental factors. And although the prognosis of breast cancer is actually really good, it relies primarily on early diagnosis and detection. And this relies on self-examination, mammograms, biopsies, ultrasounds, all of these things that are quite crude in that sense. So finding new ways to improve an earlier diagnosis would actually be quite beneficial for patients. In addition, the treatments that are currently available for breast cancer they are really good, but they can also be quite aggressive. So if we could try and narrow down and have more targeted treatments, it could potentially benefit the patients more. In the probably, I want to say maybe 5 to 7 years, the gut microbiota has gained a lot of interest, not only within the public eye, but also the scientific community, because people are realizing more and more that these bacteria in our gut can actually influence our health and also influence certain diseases. And there have been lots of studies done in terms of the gut microbiota and the link between the outcome of certain anti-cancer therapies, but these tended to focus on skin cancer or gut cancer because they tend to be more immunogenic, which means that the immune system tends to respond better, or be more sensitive, But little studies have been done in other types of cancers. And people have started noticing in mice studies, for example, that the gut microbiota may actually be involved with breast cancer. A recent paper in my lab, the Stephen Robinson lab, actually demonstrated a link between how antibiotics can impact the gut microbiota, which resulted in accelerated breast tumor growth. And so that's just one study demonstrating this in mice. But little studies have been done in humans in terms of breast cancer. And the BEAM study will be one of the very few studies currently going on, not even within the UK, but across the world, looking at this potential link in humans. It's an acronym that stands for Breast Health and Microbiota. And it's mainly a study primarily based at the Norfolk and Norwich University Hospital, so just opposite the Quadram Institute. And it's aiming to profile the gut microbiota of breast cancer patients or patients that may develop breast cancer in the future. And the idea is to profile the gut microbiota as they're undergoing their treatment pathway to see how chemotherapy, radiotherapy, or perhaps antibiotics they may be taking for surgery could impact the gut microbiota, and how this could be correlated to the clinical outcome of these patients. Physical examinations and mammograms and ultrasounds can be quite tricky and can actually be quite daunting for patients. So just perhaps profiling the gut microbiota would be a less invasive and more comfortable way for patients to be screening for breast cancer. And we hope that with the outcome of the BEAM study, we could actually find a pattern perhaps with specific breast cancer types, and how, for example, if you have this specific type of breast cancer, you tended to have this gut microbiota profile, so improving diagnostics. And then hopefully we could also see if there's a link between the gut microbiota profile and certain outcomes related to specific treatments, so certain chemotherapies, which would then improve the prognosis and clinical outcome of patients. If you would like to find out more about the BEAM study, you can look it up on the Quadron website, which is www.quadron.ac.uk/beam study. There you can find out information about why we're doing this study, what we might be looking for if you are interested in terms of eligibility. Should you be interested, there is our lovely collaborators, the NRP Biorepository, who are involved in consenting patients, also addressing any questions you may have. The consultants and the nurses at the Norfolk and Orange University Hospital, the breast care unit specifically, are also aware of the study happening. So should you be going there for an appointment or in any case, you could mention the study and they should be able to point you to the website or even the biorepository for more information.